Hello, everyone. Good afternoon, good evening, or good morning, wherever you are watching us from. We are live and direct. Hope your day was good. And it is Friday, so time to settle down and have the rest of the weekend. Today, we are here in this webinar with the title Beat Casting Before It Starts. So, here we're going to explain what character is and how we create it and what weapons can we use to beat cancer. So here with me, we shall be having our speaker, Mrs. Abuja, uh, the cancer researcher. I have also in the studio with me, Mr. Adebisi, Mr. Edwin Adebisi. So he's the man behind this whole nation with him we cannot be talking life. So these are the bodies that we have here. And we welcome you as well. You are welcome because you are very special to us. So try to get a paper, a pen, and settle down as we going to go through the presentation. If you have a question, at the end, we'll give the room for questions as well. So once again, I welcome you all to this live. So I'm going to quickly share my screen. Just a moment, I'm trying to lock my slide. So here we are going to be talking about the importance of eating well. You know, food is our own life fuel. And are you here? Are you here? I need the response. Are you here, please? Okay, so as I said, our topic here, eating well and living better, diet, lifestyle strategy for cancer prevention. Eating well, living better, diet and lifestyle strategy for cancer prevention. So I hope you can see my screen very well. Let me know if you see, you can see my screen. And if you are not seeing it, also you can let me know. Okay, so eating well, living better, diet, lifestyle strategy for cancer prevention. Yeah, I want us to ponder on this quote. They are not really cliche. First, look at let be thy medicine and medicine be thy food by Dr. Hippocrates. So we see that food is very important and making it as our medicine will make us to buy buy goods and also solve the issue of illness. What happens is that we don't eat well, then we spend money to go and buy medicine again. So it's wiser to let our food be our medicine and medicine our food. Also, I have another one here from Wigmore. The food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. When you look at it, it's trying to tell us that food can be medicine for us or it can as well be a poison. What it's trying to do is when we eat well, eat a healthy, balanced diet, the food we safe for us and it's medicine. But on the other hand, if we go junk, eating junk food, it can be a slow form of medicine. So when we don't eat right, we are killing ourselves on a gradual basis because of the illnesses that are going to result from it. Now, let's look at the third one. Health requires healthy food. Do you agree with me? Health requires healthy. So for you to stay healthy, to stay clear from cancer or from cancer not developing in your body, you need healthy food. So we are going to continue by understanding the link between diet and lifestyle and cancer. So is there a link between diet, lifestyle, and cancer development? So we are going to see. Scientific research over the years has established a robust link between diet, lifestyle choices, and the risk of developing cancer. The connection involves multiple mechanisms, including dietary components, physical activity, physical activity levels, and other lifestyle factors like smoking and alcohol consumption. So we see that food directly intake, how active you are, and other factors if you smoke or consume alcohol in excess, all those have to play to the development to your risk of cancer. Now, first, let's talk diet. Research shows that certain foods can significantly decrease our risk of developing cancer. Food rich in antioxidants, fiber, vitamins are your new best friends. So they are asking us to make food that are rich with antioxidants, fiber, vitamins, as our own bodies, as our own friend. Think bright berries. We have the strawberries, we have the raspberry, we have the blueberry, leafy greens, we have kale, spinach, we have a fruited pumpkin, what we call the ugu leaf. So those are leafy greens. We have water leaves. So let's call this as our friends. They're not like almond, walnut. They are good for us. And whole grain, incorporating this into your meal can create a powerful anti-cancer foundation. So we can build our own foundation, a wall against cancer by eating healthy. Now let's look at the consumption of red and processed meat. Today, there is more of this in our shelves today in the supermarket as we are in the 20th, 21st century and everything is on the go. We are quick. So the food we are eating is also on the fast side. And what are they doing to us? Numerous studies, including those summarized by the World Health Organization, WHO, have identified a link between the consumption of red and processed meats and increased risk of colorectal, pancreatitis, and prostate cancer. So, those that have colorectal cancer, cancer of the bowel, the pancreas, and also those that have cancer of the prostate, there is link from studies of high consumption of red processed meat. So we are learning this so that we'll take caution in consuming all this so that we don't harm our body. Now we look at fruits, vegetables, and fiber. A diet rich in fruits, vegetables, and direct fiber has been associated with a lower risk of various cancers. It lowers risk if you are eating fruits, vegetables, because it helps your digestive tract. This food contains essential nutrients, phytochemicals that prevent cellular damage. Today, we are not exposed to cellular damage from oxidative stress. So these phytochemicals, antioxidants, they are our ally in the battle against cellular degeneration. Now let's look at fat intake. High intake of saturated and trans fat have been linked to a higher risk of certain cancer, such as breast and colon cancer. On the other hand, fat in fish and vegetable sources like omega-3 fatty acid may have protective effect against cancer development. So when we're talking about this plants of fat, think avocado. Avocado is a healthy fat that is good for your heart and your blood vessel. So that has a protective effect against against cancer development. How about micronutrients? Cer- Certain vitamins aminoacids, especially those with antioxidant properties. And when we are talking about those, we mention vitamin A, vitamin C, and vitamin E, as well as selenium and zinc. Researchers have proven that they play a major role in cancer prevention. So it's good that we have these fruits and veggies that God has given unto us. We eat them and make us well. Now, what we're going to look at a few of those vegetables that good for us, that have chemicals, compounds that can help us wage war against cancer. One of them is broccoli. Broccoli, we also have turmeric, uh, is very common worldwide, and that is onion, humble onions, as common as it is. It has a compound that can help us to fight this cancer. And also, recent researches have brought plant stem cells into limelight, and they are helping in no small great way in the health and wellness of, of individuals. So let's talk a bit about broccoli. Broccoli is a green vegetable. It belongs to the cruciferous vegetable family, which include Brussels sprouts, cauliflower, and cabbage. Brussels sprouts, cauliflower might not be very common in some places, but I think cabbage is more common. It contains several potent compounds that are believed to boost its anti-cancer properties. The most notable being sulfur, sulfur. And this is, if you see broccoli, you see that it has a distinctive kind of uh, flavor. I will not call it smell, a kind of flavor. So it has sulfur compound that is giving it that strong flavor that it has. Studies have shown that people with a higher consumption of broccoli are they have safety against against cancer. So let's ensure that we have this broccoli if it's in within our region and environment. Let's go and put it on our shopping list when we're going for shopping. It's very good. The sulfur contained broccoli has been shown to enhance the production of detoxification enzymes in the body. You see that the liver, our house, that detoxifies bad chemicals, bad gas from our body. And this broccoli tends to enhance the function of the liver. So, in that, it helps to eliminate potentially carcinogenic compounds more effectively. Also, that has antioxidant activity. Broccoli is rich in glucosamine, which the body processes into sulforaphane. This compound leads to the body's protective enzyme and flushes out cancer-causing chemicals. Now, look at turmeric. This is common turmeric. We have it's a right in the family of ginger, but this yellow color, and this is what gives the color to curry that we use in our cooking. It has antioxidant property, curcumin. It's a strong antioxidant that can neutralize free radicals. Remember, free radicals, they are the reactive chemical reactive molecules that cause damage to our body cells. Now, S or the turmeric peppers, the curcumin has also is also been shown to affect the cancer cell growth and the development of them. It interferes with the molecular pathways involved in cancer progression and inhibits the growth of tumor cells in a wide range of cancer. So that is turmeric for you. Ensure that you are having quantity, good quantity of it in your daily uh, meals. Try to incorporate it in your diet, and it's of great help. And we also see that black pepper can help us to activate the chemical in turmeric. So if you combine black pepper with turmeric, it's of great advantage. Now let's talk about our combo onion. There is hardly a dish that does not have the onion, so they are very good. As common as they are, let's not play on them. They have God-given chemical that can help us. So let's see the evidence of restriction. Studies shown that people with higher consumption of onions and other vegetables like garlic, they have lower risk of several types of cancer, including stomach cancer, colorectal, that's in our bowel, and prostate cancer. Research published in the World Journal of Gastroenterology also noted a significant relationship between increased consumption of the allium vegetable and a reduced risk of gastric cancer. And because they have a distinctive flavor, as I said before, I'm going to call them that is a smell that usually people is, but it's actually that flavor that is soft compound that have the anti-cancer property. So we also see other studies that talk about the flavonoid called quercetin. Quercetin is a special flavonoid in onions, in garlic. They can suppress the growth of breast, colon, and prostate ovarian cancers. So let's ensure we have them included in our diet. So consuming onions regularly, a part of the diet. You can eat it raw or use it in food and vegetables. A diet with onion, fruits, and other vegetables can contribute to a balanced diet that may help reduce the risk of developing cancer. The anti-cancer effects are the most potent when onions are consumed as a part of a varied diet that includes a wide range of other vegetables and dietary antioxidants. So it's not singling out onion that you consume only onion, no, but it's synergic uh, activity. You get onions, you get this from broccoli, so when they come together, they play an important role in protecting you from cancer. So before we round up the side of vegetable fruits and vegetables or dietary protection that can help us from cancer, I mentioned stem cells. Stem cells, they are red blood cells. If you think of stem cells, let's look at a picture like this. If you cut you have a maybe a mango tree that is growing in a compound or a pear tree. It could even be an orange. When you cut the back and the root of the tree is still on the soil, you see that give it a month. You see that gradually grows back to this the front edge. What is there is the power of regeneration. So this power the plant stem cells, they rest, they come to the place where there is danger, where there is damage, and they come to rescue whatever is going on that is wrong here. And if you look at a picture again as fire, when do we call the fire brigade? When there is fire. So also these stem cells, they are like fire brigades in our body. Once they sense that there is the damage, dying, and abnormal cells, and as we are going to hear from our presenter, cancer cells are abnormal cells. So these stem cells, they help to fight against them and also replaces them. So in that way, you have protection against abnormal, weak, damage, and a dying cell. But here is where it's really exciting. Recent advances have brought us stem cells fused herbal, where people now have stem cells fused herbal as supplements that are making headlines today in our world. Some conditions, including cancer, that were treatable, they are responding to this stem cell, and thank God to this breakthrough innovation. They are not they are not potential, they are not your ordinary supplements. They combine the healing potential of plant-based foods with the regenerative properties of stem cells. So having them as your body, taking them on a regular basis can help shield you, protect you. We are talking about prevention. Adding them to your diet, using them to substitute, will go a long way to protect against the formation of cancer. So broccoli, onion, turmeric, they have given us promising anti-cancer properties. in various studies, as I have pointed some of these before. So regular consumption of this food, along with balanced and healthy lifestyle, may contribute to a reduced risk of cancer. So it is good that God has given us these insights that we can use as medicine. Let medicine be your food and let it be your medicine. That is what we started with, a quote from Hippocrates. Now, we are going to talk about lifestyle factors. Eating well is very good, but if you are not active, it's not too good because you are only doing one side of the protection. A healthy lifestyle, staying and maintaining a healthy weight are key to us living healthy. So regular exercise, even something as simple as a daily walk, it can be like 15 minutes walk, 30 minutes walk. It can help to lower your risk of this cancer. Now, let's physical activity. Regular physical activity is consistently associated with a reduced risk of cancer, particularly breast, colon, and endometrial cancer. Physical activity can help regulate hormones, reduce inflammation, and improve immune function, which may protect against cancer growth. And these are all located in the development of alcohol consumption. Alcohol consumption is a known for cancer development, especially those of the mouth, the throat, the liver, the breast, and others. The risk increases with the amount of alcohol that is consumed. So those that are alcoholic drinking in excess, you are harming yourself because first of all, you are destroying your liver, which is the powerhouse that's supposed to destroy all the antibodies coming in your body. So by the time you weaken the liver, weaken your immune system, then you cannot resist cancer cell. We talk about body weight. Obesity is increasingly recognized as a significant factor for several types of cancer, including breast, prostate, colorectal cancer. The risk is thought to be due to excess body fat, hormone level, and inflammation. And that is why trying to maintain a healthy weight is your requirement to stay healthy and stay clear from this cancer. We are not saying that those that are slim does not have the cancer. If they do, they are all factors that are involved. So let us maintain a healthy weight. It's good for you. Now we look at tobacco use. Smoking and other forms of tobacco use are among the most significant and preventable causes of cancer worldwide. We call them preventable because if you don't go into smoking, then you don't have to start such cancer. So let's some people tips that we can follow in our everyday life. Incorporate more fruit and vegetables into our meal. reducing sugar, salt, and unhealthy fats. I give you a short story about sugar. But sugar is not a friend, sweet, but it has a bitter after. When I left my tree and came into the came to Ireland, to the Western. One day I went to the market and I saw because I used to consume eat it and I left it back home. I was happy. I said, I can see corn there. So I was eating and I bought corn from the uh, farmer's market. But behold, when I got home, I cooked the corn and tried to eat it. It was if they pour a whole cup of sugar into the cup. So that is different food. Some food that you are eating contain so much amount of sugar that can harm you later. So let's be on the watch. Increasing physical activity in our daily routine. Try to plan and have a time to exert yourself to do exercises. You might not need to register in the gym, but after walk, you can walk, you can jog, or you can do ride your that's also exercise. Swimming, that is also exercise. Setting realistic goals. Let's set goals for our health. As we are planning for the health for the year. This is what I'm going to do. This is what I'm going to do. Let's also put a plan in place for our health. This is how I want to be healthy. This is how I want to do exercise so that keep up my health. So all those will help and also regular medical checkup and screening. There are places that they have screening and free. Let's say giving our body for the checks because what do they say? They stick in time, save nine. So if they pick it up on time, then be able to manage early. So thank you for uh, being here and giving me audience. So the end of the presentation, how we can inspire and like to reduce or prevent our risk of cancer. I am Juliet Oriri, the CEO of the Pathway. You can visit us on our website, livewellpathway.co.uk. Follow Facebook, Natural Peace and Happiness, and also join our community, Nourish to Flourish. Thank you.
Okay, so the title of my presentation is Beat Cancer Before It Starts, and my name is Mrs. Amo Azizatolai. I am a biochemist, oncologist, and cancer researcher. Okay, so during the course of my presentation, I'll be guided by the following outlines. The last 50 years has seen a better understanding of the causes and treatment of cancer, and hence the stigma and the prognosis have really improved. Cancer is a group of disease characterized by uncontrolled proliferation of cells. That means the cells that are supposed to continue to that are supposed to divide to a finite number of cell division are now dividing into an infinite number of cell division. So these cancer cells they do not undergo this programmed cell death known as apoptosis. Apoptosis is a form of programmed cell death where normal cells undergo when they are due for death. but these cancer cells have overcome their fate of cellular senescence in the sense that they have upregulation of their telomerase enzyme. This upregulation makes them unable to die when they are supposed to die. So stress has been linked to cancer development. For example, when you are stressed, there are some stress signals. For example, the NF kappa beta stressor pathway that are activated. This promotes tumorigenesis. Tumorigenesis is the term used to to define a state that which tumors grow excessively. So it induces DNA damage. During cellular division, the normal biology that we know that cells undergo cell division. And this cell division, there has to be checkpoints on to make sure that these cells don't go out of control. These cancer cells evade these checkpoints, thereby inducing DNA damages and suppressing the checkpoint P53 function and supports cancer growth by influencing the tumor microenvironment. So classification of cancers, we have the carcinoma, which are cancer of the skin. During the course of my presentation, I will dwell more on these types of cancer. We have the carcinoma, the sarcoma, the lymphoma, and the leukemia. Leukemia are cancers of the white blood cells. So lung cancers have been shown to kill 164,000 people in 2000. So prevention of this has been linked to smoking. So we found a correlation between smoking and lung cancers. Smokers are liable to develop lung cancers when they continue with this smoking. Okay, so there has to be some changes, some cellular changes because spontaneous errors. That means errors during the time of DNA replication. Ẹ ó ti stop. Ẹ wo àdúgbò yìí ẹ̀rọ ni ẹ̀rọ factory. We have external agents, for example, diethylstabirol. We also have ethidium bromide. Once there is an interaction with your cell, they can lead to cancer. We also have oncogenes. That means the oncogenes are genes that promote cancer. So risk factors in cancer, smoking is the greatest, nutrition and exercise. And nutrition plays a vital role in cancer development. So our speaker, what has actually dwelled more on this nutrition and the probability of cancer as a result of bad nutrition. So we can see from this chart that unbalanced diet leads to 30 to 35 cancer development. Smoking and alcohol leads to 30%, chronic infection 18 to 20%, and hormones. Okay, so biological cofactors that can cause cancer, the genetic predisposition. This means that what? That if you have family history of cancer, you yourself you have the probability of having high cancer development. So we also have productive and hormonal risks. We know that females are more prone to cancer than male, to breast cancer, due to the presence of BRCA1 and BRCA2 genes. So we also have occupational and environmental factors. For example, people that work with asbestos, nickel, and chromium, and radioactive substances. For example, the woman that discovered the DNA, it was this phosphate that was found to be in her cell that led to her death. So social and psychological factor. We also have stress and decreased negative emotions. When we are happy, our dopamine increases, and this dopamine has been known as happy hormones, which can reduce our risk of developing cancer. So chemicals in food preservatives such as sodium nitrate and colloidal silicium can lead to cancer. We also have viral induced factors. For example, the human papilloma virus from herpes related virus, and also medical factors. So looking through this chart, we can see how we can decrease our risk of having cancer. We have the use of vegetable and fruit. This can help us to reduce cancer to a large extent. So 1 in 8 women have been shown to actually have breast cancer, and early detection can reduce the risk of breast cancer. So I would advise for self-examination. As we progress with this cancer, with this power presentation, I'll talk about how we are going to be able to do early detection by checking a lump for lumps in the breast. So the risk increases with our age, and research has been shown that self breast examination can help us detect early cancer, and which can improve the prognosis. So how to examine your breast? You stand in front of a mirror with your arms by your side, then turn slowly from side to side to check for lumps. So when you raise your arm above your head, you repeat this examination, and you do it in a circular manner that you use to check for lumps. So how to feel for changes? You do that lying down. So if you need more clarification on how you can do this breast examination, please don't hesitate to chat me up to dwell more on this. So the types of cancer also include colon and rectum cancer, which has to do with the digestive tract. We can see that this is the third most common cancer in men and women, and about 135 cases have been diagnosed in 2001. So when you see this warning signs, you see blood in the stool, or you have bleeding from your rectum, you should know that it's time to check yourself for colon cancer. Okay, so cancer is actually not a death sentence. Okay, so early prognosis and with the right diet can help us to a large extent to reduce the chances of early death. Yes, it cannot be cured, but it can be managed. Okay, so we also have skin cancer, and in fact, exposure to sunlight have been shown to ultraviolet light have been shown to increase our risk of skin cancer. We also have testicular cancer. These are cancers that happens in the testes, and people of ages 17 to 34 have been shown to be of greatest risk. The cause of this is still unknown, and undescended testes present a great risk. And so if you have a male child, check for testis descendation to know if your child is prone or not prone to having cancer. So men should also examine their testes. Ovarian cancer, this happens to young women. It is the fourth leading cause of death. Enlargement of the abdomen have been shown to be a figure to ovarian cancer. So you can actually have annual pelvic examinations with your gynecologist or your doctor to check if you're at risk of ovarian cancer. There's also been shown that early marriage can actually reduce the risk of all these types of cancer. Okay, so cancer of the pancreas. The pancreas is the one that it regulates insulin glucose uptake by the production of insulin. So if anything happens to the pancreas, for example in diabetes, where the insulin is resistant to glucose, we in the condition of diabetes or inflammation or high fat diet can actually lead to cancer of the pancreas. Leukemia, that's cancer of the blood forming tissues, leads to creation of immature white blood cell. So there will be immature white blood cell in circulation when this patient presents to the lab and we see immature white blood cells in the blood of such patient, we know that this patient is susceptible to leukemia. And the symptoms include what? Fatigue, paleness, weight loss. It can be acute, that means short term, or chronic, which is long term. So the warning signals of cancers include what? Changes in bowel or bladder habits, a sore throat that does not heal, unusual bleeding or discharge, thickening of the lump of breast elsewhere, indigestion or difficulty in swallowing, obvious change in what or more. Let me make more point on this. We know people that have skin tags. So when these skin tags, when they begin to proliferate, that means they become bigger. It should be a warning sign, because a cancer that is benign can become what? Can become cancerous. In cancerous in the sense that it can even metastasize, meaning it can move from one place to another. And someone that has cancer of the skin will now begin to have cancer of the liver or cancer of the bone marrow and all. So the cancer can change location from one place to another. So if you notice a wat or a mole or a skin tag that begins to increase, that begins to swell more than it was usually, it's time for you to see your doctor. So new hopes in cancer treatment. We know of my mastectomy, that's complete removal of of a tissue that has cancer, for example the breast. We also have chemotherapy. Although chemotherapy has also been linked to an increased chance of cancer, but at least you talk to your doctor to know your chances. Also researching genes that causes cancer. For example, we have the tumor suppressor genes, the proton genes, and the DNA repair genes are the genes that mediate apoptosis. So alteration in any of these genes can actually lead to cancer. So talk to your doctor about the cancer type, then let's know about treatment options that are available for you, and speak to your doctor why this particular treatment is preferred out of all the options that you might have. So this is a diagrammatic illustration of a benign tumor. They are actually enclosed inside the cell. They cannot metastasize. In the other malignant tumor, we can see that they are not encapsulated. So we have seen that they are actually moving out of the primary site, so they can have a secondary site. The secondary site is a place where the tumor has migrated into. So cancerous cells can spread, while cells that are not cancerous are known as benign tumor. So that's the difference between benign and malignant tumor. So cancer that begin on the skin are known as carcinoma. For example, we have the adenocarcinoma, the basal cell carcinoma, which affects the type of epithelia that it can affect. So sarcoma, they are cancer of the bone or cartilage or the connective tissue. Sarcoma, we can have osteosarcoma, which is cancer of the bone. All these terminologies are big terminologies that doctors uses, but they're actually small language if you break it down. So sarcoma means what? Something that forms in the bone. So we can have osteosarcoma. So leukemia is cancer that begins in the white blood cells or the blood forming tissues. So we have cancer of the white blood cell. So this abnormal white blood cell will now enter the blood and will be circulating in the blood. So we also have lymphoma and myeloma as cancers of the blood as well. So cancer that affect the central nervous system are also present. The central nervous system are the brain and the spinal cord. So in normal cell division, a cell that is damaged will undergo apoptosis. Apoptosis means what? Programmed cell death. That means the cell is no longer viable. But in cancer cells, these cells are not viable. They have a mechanism of evading. It's just like when you're going on the road and you're traveling, maybe stay from Lagos to Ibadan now. We have police at each checkpoint. So these checkpoints checks for a defective cell. So this what these cells do is they um phosphorylate the enzymes or the checkpoints. They phosphorylate or phosphorylate them at the active site. So when they do this, they are able to evade this death and they're able to proliferate. Another intriguing thing about cancer is that cancer cells is that they grow even without even without growth factor, because normal cells require growth factor in order to replicate. But these cancer cells, they can grow without growth factor. They can also grow new blood forming tissue, and they even have a way of oxygenating themselves. So they are very, very disastrous. So I hope you have learned one or two things from my presentation. Thank you for listening, and any questions.
Much, and that is from our cancer researcher, Mrs. Azleta. She has done
Thank you, ma'am.
justice to that topic. And now I know you what cancer is, the predisposing factor, your risk for it, and I have also dealt with how you can overcome prevent. So that's all we have to give us today. We'll wait for questions if you have a question to ask. Do we have a question? Uh, no question. Okay. In case you watch this later, you have a question, you can put your question on the comment section and we'll get back to you. So back to Mrs. Azita. Do you have anything you want to say maybe about our science group, the whole step?
Okay, so I'm back on stage.
Okay.
So thank you for your wonderful presentation, ma'am.
So thank you as well. I've learned it.
So
So do
yes, I learned.
you want to have the slides? How can they get them?
Okay, so for those who want the slide, contact Mrs. Juliet privately. So the slide will be available through her.
All right. Okay. I think we don't have the questions on the stream. We might have later in the our pages every group. Okay, thank you everybody for paying attention. I hope you have
Thank
a
you, bro.
wonderful day. spread the word. We have just started this program. Let us know when the next. Today we have spoken about prevention, how we can prevent cancer. Next, we'll talk about management. If you have
Okay.
how do you manage it? So, don't go so far. You can add our chat on our groups and you'll be informed. Thank you again.
Thank you. Thank you for your time. Thank you, everyone.
Thank
Bye
you.
bye.
Good night. Bye. So, have we